Senator from Wisconsin.
Mr. President, I rise today to join my colleague, Senator Mark Warner, and the entire Senate Democratic caucus to force a vote on his resolution to protect Americans with pre-existing health conditions and stop the Trump administration from using American taxpayer dollars to promote junk insurance plans that don't even have to cover people who have pre-existing health conditions. The difference between the two sides of the aisle here are really clear. Senate Republicans have worked with President Trump to pass repeal plans that would take people's health care away and allow insurance companies to charge more for people with pre-existing health conditions. When their effort failed legislatively, instead of working in a bipartisan way to lower health care costs for working families, President Trump and his administration spent 2 years working to sabotage our health care system. The Trump administration's sabotage has made it harder for people to sign up for quality, affordable coverage. And today, there are more Americans uninsured than when President Trump took office. The Trump administration is even in court supporting a lawsuit to overturn the Affordable Care Act completely, taking away guaranteed health protections and raising costs for Americans with pre-existing health conditions. If they succeed, insurance companies will again be able to deny coverage or charge higher premiums for nearly 130 million Americans who have a pre-existing health condition. Meanwhile, this administration has expanded what we call junk insurance plans. These are plans that can deny coverage to people with pre-existing health conditions and don't have to cover essential services like prescription drugs, emergency room visits, and maternity care. I ask my friends on the other side of the aisle to think about this for a moment. President Trump supports overturning the law that provides protections for people with pre-existing health conditions, while he is expanding these junk plans that don't provide those protections. This is what they support. This is their plan. Last year, we forced a vote on my legislation to block President Trump's expansion of junk insurance plans that don't have to cover people with pre-existing health conditions. The final vote tally was 50-50, with the entire Senate Democratic caucus and one Senate Republican voting in support of my legislation. Anyone who says that they support health care coverage for people with pre-existing conditions should support the No Junk Plans Act. So today I want to take another vote. I ask unanimous consent the Help Committee be discharged from further consideration of S. 1556 and that the Senate proceed to its immediate consideration, that the bill be considered read a third time and passed, and that the motion to reconsider be made and laid upon the table with no intervening action or debate.
Is there objection?
Mr. President, reserving the right to object.
Senator from Tennessee.
The senator from Wisconsin is exactly correct. Every Senate Democrat has voted to take away lower cost insurance from what the Urban Institute says is 1.7 million Americans, people who can't afford other kinds of insurance. That's what they want to take away, and she's attempting to do that once again. I have plenty of constituents who have a right to get their insurance, but they can't afford it. And this is the only kind of insurance they can buy. This kind of insurance was good enough for the George W. Bush administration. It was good enough for the Clinton administration. It was good enough for the Obama administration right up until the last few days, and it should be good enough under the Trump administration. All it does is give 1.7 million Americans, according to the Urban Institute, an opportunity to buy short-term insurance while they move from one job to another or while they look for a different situation. According to the Urban Institute, those 1.7 million Americans would otherwise go insured. That's what the Democrats are for, so I object.
Objection is heard. Senator from Wisconsin.
You know, obviously I'm disappointed with the objection and would point out that these junk plans are often called short-term plans, but the change that was made by this administration was to go from a 3-month sort of transitional plan, as my colleague indicates, that could be used when you're changing employment or other short-term use, and now they're available and renewable for up to 3 years. These plans do not preserve the protections under the Affordable Care Act to cover people with pre-existing health conditions and essential health benefits. And you don't have to take my word for it. We can read directly from the fine print on the actual plans that are being debated. One of these junk plans currently available in my home state of Wisconsin from Companion Life reads, quote, "This plan has a pre-existing limitation provision that may prevent coverage from applying to medical conditions that existed prior to this plan's effective date." Another junk plan from Golden Rule says that the plan doesn't comply with the guaranteed essential benefits provided by the Affordable Care Act. To quote directly from the plan, the description reads, quote, "Even if you have had prior Golden Rule coverage and your pre-existing conditions were covered under that plan, they will not be covered under this plan." It's abundantly clear that these plans don't cover protections for people with pre-existing conditions. The people of Wisconsin did not send me to Washington to take away people's health care. I want to protect the guaranteed health care coverage that millions of Americans depend on. I want to help more families get quality, affordable health care that they need. And despite the sabotage that I've described from this administration against the Affordable Care Act, in Wisconsin this year, things are getting better with a new governor. Thanks to strong leadership from Governor Evers and the investments his administration is making, Wisconsinites will have more choices and more affordable rates for quality health insurance plans this year. Wisconsinites in every corner of the state will be able to find health care plans that include essential benefits like prescription drug coverage, maternity care, emergency room visits, and mental health care for more affordable prices this year. Governor Evers is providing funding for more health insurance navigators and conducting awareness campaigns in the state so that families in Wisconsin will have the information they need to sign up for quality and comprehensive health care plans. That's why enrollment navigators are so important. We need to keep up the funding for navigator programs so that more people can find an affordable health care plan that meets their needs. Navigators help millions of Americans, including those in rural communities, sign up for quality health care coverage. The governor of Wisconsin understands the importance of navigators, but Washington has failed to step up. Unfortunately, since President Trump took office, his administration has slashed federal funding for the Navigator program by 84%. Trusted Navigator programs like those in Wisconsin have had their funding cut by nearly 75% since 2017, meaning fewer people in Wisconsin have received the support they need to obtain affordable coverage. That's why I introduced the Enroll Act this year with my good friend from Pennsylvania, Senator Casey. This bill restores funding for the Navigator program and helps ensure that Americans have better access to affordable health care coverage that they need and want. The Enroll Act passed the House of Representatives earlier this year. We should pass it in the Senate also, so that Americans can more easily enroll in quality health care coverage. So I ask unanimous consent that the Help Committee be discharged from further consideration of S. 1905, and that the Senate proceed to its immediate consideration, that the bill be considered read a third time and passed, and the motion to reconsider be considered made and laid upon the table with no intervening action or debate.
Is there objection?
Mr.
The
President,
senator from Tennessee.
reserving the right to object. In 2017, the Centers for Medicare and Medicaid Services found that navigators were not cost-effective in enrolling people in health insurance. During the 2017 open enrollment period, navigators received over $62.5 million in federal grants while enrolling 81,426 individuals. That's fewer than 1% of those enrolled in the federal exchanges, which come out to a cost of $767 per enrollee. In other words, the taxpayer is paying $767 per enrollee for each person enrolled. CMS also found that nearly 80% of navigators fail to reach their enrollment goals. I object.
The objection is heard.
Mr. President.
Senator from Wisconsin.
Well, I'm disappointed to see my Republican colleague again object to legislation that will help more Americans access quality private health insurance, Medicaid, or children's health insurance program. This is especially harmful to families in rural communities who already lack access to in-person assistance for shopping and enrolling in quality, affordable health insurance coverage. So let me lay plain for everyone that what we are seeing here from Republicans in this administration. Republicans today objected to passing my Enroll Act, which provides funding for health care enrollment assistance to help people find high-quality, affordable plans that actually meet their health care needs. Republicans today objected to passing my legislation to stop the expansion of junk insurance plans that don't even have to cover people with pre-existing health conditions. Republicans are working to make it harder to sign up for high-quality, affordable health care. This administration is encouraging Americans to buy junk insurance plans that don't provide health coverage that you need and can deny coverage to people who have a pre-existing health condition. And finally, Republicans and the Trump administration are supporting a lawsuit that would overturn the entire Affordable Care Act and take health care away from literally millions of American families. Mr. President, the choice for the American people could not be clearer. I'm working with my Democratic colleagues to help make things better for the American people, and sadly, Senate Republicans are helping the Trump administration make things worse. I will not give up this fight, but for now, I yield the floor.